10 common causes of pitching injuries. So I decided to make this presentation because I love baseball, I hate seeing kids get injured, and so many of these injuries can be avoided. Now, whenever I worked with a client in the past that was either a pitcher or was talking with their mother or father, or if I had somebody who was a youth baseball coach, I would always sprinkle in these causes over the course of working with them, or share a bunch of different articles with them, most of which I probably didn't read. So I figured, why not make a presentation that puts it all in one place, and I can share it with them much easier that way, and then they can share it with their friends and other parents or coaches. So what I hope you get out of this is an awareness and better understanding of some of the common reasons why pitching injuries occur. For me and other people in the field, this is somewhat common knowledge to us, but I realize that it's not necessarily common knowledge to the general public. Now, from this, you'll get some easy to implement ways to reduce the risk for injuries. And overall, what I want you to get out of this is healthier and better performing players, or your own son or sons. So who am I? I'm Dennis Trubig. I'm a doctor of physical therapy. I'm board certified specialist in sports PT. I have about 15 years of experience in the sports and orthopedic fields. You can think of me as more of a performance physical therapist and not just your general basic PT. I specialize in helping athletes and active people, recover from injuries, get back to playing their sports, or enjoying an active lifestyle. I also help people perform better in their sports or avoid injury. I'm located in Long Island, New York. Growing up, baseball was my primary sport. I played all the way up through high school. I pitched on every team I was on. And from about the age of 13 on, I'd say that I dealt with some type of shoulder and or elbow pain throughout the year. Ultimately, I ended up getting later on a labrum repair surgery. And the reason I say all this is because what I want you to know is that not only do I understand the medical side of it, I also understand it from the position of the player. Now, just some numbers on pitching injuries. We all know that they happen a lot and they're happening more and more, but it's always interesting to see some of the numbers that are out there, some of the stats that are out there. So the first one, about 3/4 of youth baseball pitchers report experiencing pain in their arm, which that's pretty alarming that it's that high. Okay. And an even more alarming stat is the next one, that 30% of players reported that pain caused them to have less fun playing. That's the whole reason that kids are playing sports, is to have fun. There's so much you can learn from sports, so much benefit to playing sports. And if we're taking the fun out of it by allowing them to get hurt, that's a big deal. Now, another even more alarming stat, because it falls on the adults in this situation, is 46% of players were encouraged to keep playing despite having arm pain. Again, that's on the adults. That's on us. All right, now just overall looking at the top 6 injuries in the majors and the minors, it's a little bit skewed because it's all players. It's not just pitchers. Okay, but just know that 39% of all the injuries occurred in pitchers. So a good chunk of the injuries were in pitchers. So out of all the players, the number 1 injury is a hamstring injury. And then you'll see the number 6 injury is the UCL injury, or the Tommy John ligament injury. It's number 6 on the list, so it's not the most common, contrary to what many people would think. People probably think that because it gets so much media attention, and also because out of all the injuries, the UCL injury is the one that causes you to miss the most amount of time. Okay, it takes about 15 months, 12 to 16 months, maybe 15 months on average to get back to playing. So that's why it gets a lot of publicity. Now, just to go over some more numbers on the Tommy John surgery, because again, this is what gets all the media attention, which is what a lot of people like to talk about. It's probably the most significant injury that can happen because it makes you miss the most amount of time, like I said. So despite how much attention is on this and how much more we know about Tommy John surgery and the injuries continue to increase. So we know more and more about it. We're looking at it more, paying more attention to it, and it's still increasing. Now, if we look at this 2018 survey of pro baseball players, and the nice part about this is they can compare it to a similar survey that was done in 2012. So you have 25% of all Major League Baseball pitchers have had Tommy John surgery in 2012 and 2018. So that some people would say, oh, that's a good thing. It's not getting worse. It's stabilizing. The problem is, if you look at the minors, minor league baseball is up 15%. So in the medical world, what we're becoming aware of is the fact that people are getting Tommy John surgery at a younger age. So they're getting it before they even get to the majors. And another thing to note about the study is that it did include players that had the surgery and were unable to return to baseball, which does happen. So some of these numbers could be even higher. Now, if we look at another study by Dr. Chris Ahmad of the New York Yankees, he looked at Tommy John surgeries in the state of New York, which is where I happen to live. He saw that the number of surgeries increased 193% between 2002 and 2011. It's probably even higher now because that was 9 years ago. And the more important thing, I think, is that there's a significant trend towards the age of the surgery going down. So kids are getting younger and younger when they get this. Another study, 343% increase in Tommy John surgeries. Again, 56% of those were kids. Very alarming. And another thing to mention, it's a myth out there that people think that velocity goes up after surgery, and that's just not true. Velocity does not go up after surgery. If somebody's throwing harder after surgery, it might be because they're older and stronger. It might be because their velocity was dipping down before the surgery because they were pitching on an injured elbow. So it does not go up after surgery. Please don't think that. Now, most baseball injuries are classified as this overuse injury because it's not just one pitch that does it or one event that does it, typically. And I think the term overuse injury is a little bit of a misnomer because of the information we know. So if we look at this 2012 survey of youth baseball coaches about their knowledge of safety guidelines, overall, coaches answered 43% of questions correctly, so less than half. 27% just flat out admitted to not following the safety guidelines. The number is probably even higher because some people didn't want to admit that. 19% of coaches reported that they pitch a player while having a sore or fatigued shoulder or elbow, which later on you'll see how disastrous that can be. So we say, oh, that's 2012, pitch counts started to come about more then and gain more popularity, so it's understandable that most coaches didn't know about them. Well, let's fast forward to 2018 survey. 56 were non-compliant with pitch counts recommendations. And only 13% of coaches were able to correctly identify risk factors for overuse injuries. So 87% weren't, and that's one of the reasons why I'm making this presentation, to try and get more people aware of that. So if we're aware of these things, they're out there, then the overuse injury is somewhat of a misnomer because it's more like abuse or neglect. Now let's just look at the stress of throwing a baseball. It is the fastest motion of all sports. Arm rotates about 7,000 degrees per second. Some studies even say 8,000 degrees per second. I can't even wrap my head around that. It's just ridiculously fast. Okay? And it requires everything from the head to toes to work together in unison. So if there's any dysfunction or any abnormal movement somewhere in that chain, that can cause more stress in a different area of the chain, and that can lead to an injury in a different area. Overall, more velocity equals more stress. Okay? The harder and more often you throw, the higher chance of injury. It's, in a way, just as simple as that. Now let's just take a look at a couple of these pictures, and obviously the thing that jumps out at you is that their arm is basically pointing behind them, which is a very unnatural position for your arm to be in, unless you're a pitcher, and then it's very typical. Okay, if we were to lay these people down on a table, their arm could just about point straight down towards the floor, whereas most people, their arm is about parallel to the floor. Now, I don't want you to think of throwing a baseball being stressful on just the arm, because it's the whole body. If you look at these pictures, you'll see, look at their legs, look at their hips. They're in some pretty extreme positions too. So you have some extreme positions of the arm, extreme position of the legs. What's in between there is your spine, okay? And that has to dissipate a lot of the stress and transmit a lot of the forces through there. So now let's go into some of the common causes for pitching injuries. These are not ranked in order as number 1 being the most important and number 10 being the least. They're just numbered so that you can discuss them with other people a lot easier. The first one is specializing in baseball from an early age. Now let's just talk briefly about specializing in sports in general, not just baseball, but in general. Okay, it's specializing early on in one sport can be more detrimental to your child than it can be beneficial. Okay, there's increased injury risk, there's shorter athletic careers, there's increased mental burnout from just focusing on one sport and all the pressure. Okay, specializing early doesn't produce better athletes. Okay? If you're only playing one sport all year round, all you're learning is how to move in that one sport. Okay, if you play multiple sports, you get exposed to so many more different movements and situations that you will become a better athlete. The problem with early specialization is there is so much social pressure to do so. People think that if you don't specialize early, you're not going to be good, you're not going to go to college, you're not going to make it professionally. And I want you to know that with regards to baseball, about 7% of high school baseball players make it to the NCAA level. Okay? And less than 1% of high school baseball players make it to the major pro level. So the odds are already stacked against you. One way to decrease those odds is to get injured. So here's a quote from the author of the book Warrior Girls, which is a book about girls' youth soccer and injury rates. So I'm going to pick up about halfway through there. There's an assumption that specialization makes kids better at their sport, that it promotes mastery, but it doesn't. Every expert will tell you that it absolutely doesn't. And he's true. Okay, it will not help your kid by specializing that early. If you want to specialize later on, that's fine. But expose your kid to as many sports as possible. Make them the best athlete they can be. So here are some more numbers on things. Everybody likes numbers. Athletes who specialized in one sport were 70 to 93% more likely to be injured than kids who played multiple sports. Again, you want to decrease your chance of your child being successful in a sport, have them get injured. Okay. Statistically significant higher rate of serious injury during a baseball player's professional career and those who specialize early. Now this is an interesting one because it surveyed professional baseball players, and 63% of them, so almost 2/3 of them, believe that early sports specialization was not required to play pro baseball. So these are the people that are the elite of the elite, the best of the best, and they're telling you that they don't think that early specialization is necessary to be successful to play pro ball. So kind of summarizing it, specializing in baseball from an early age, it leads to significantly more exposures. And we know the more pitches thrown in a season and cumulatively over the years, the more likely you are to have injury. Okay? The other thing is when you play year round and you're specializing in it, it doesn't allow for proper rest and recovery from the stress of throwing. Throwing is probably the most stressful thing you can put your body through, and you need to be able to recover from that. Okay, there's a reason professional athletes have an off season. All right, it's to recover from the demands of their season. So the best thing to do overall, I think, and what I recommend to people is play another sport and become the best athlete possible. So moving on to number 2 is not using pitch counts. Okay, pitch counts have been studied extensively and they've been implemented for a reason. They're based on science and injury data. And they're in place to protect the players and allow for proper recovery, not to potentially screw up your season. Out of all the studies that have looked at injuries in baseball, easily the strongest correlation to injury is the amount of pitching. Okay, the pitches thrown, the innings thrown, all of that over the course of a year correlate the strongest to injury. Now you might say, oh, well, pitch counts have been around for a while, so everybody's using them. 45% of youth pitchers pitch in a league without pitch counts. Now, if you're in a league that's governed by something like Little League Baseball, obviously, well, I shouldn't say obviously, they're going to have safety guidelines in place that you have to follow. But if once you go to the travel teams, independent teams, then some of them might not be regulated by governing bodies and they might not have pitch counts or safety guidelines in place. So if we look at pitch counts and injury risk, if you average more than 80 pitches per game, it's a 400% increase in injury risk. That's a significant increase in injury risk by just averaging more than 80 pitches per game. So here's a sample of a recommended pitch count. This comes from MLB PitchSmart, which is a great resource to follow and to go to if you need any more information. So you just go by the age, number of pitches thrown, it gives you the required rest days. It really is that simple. That's all you have to do. So number 3, pitching for multiple teams. All right, this increases the risk for injury not only because you're throwing more when you pitch for multiple teams, but also because it makes it more difficult to monitor pitch counts if one team is monitoring them and one team isn't. And also because players have a hard time getting the necessary rest between pitching bouts. You pitch for one team, the coach thinks that you're off for 3 days, but on day 2 you pitch for a different team. Right now, if we look at how often this happens and some of the numbers on that, 30% said they pitch for multiple teams with overlapping seasons, which makes it even worse. It's not like there's separate, distinct seasons. 43% pitched on consecutive days, which I think we can all agree is a bad idea. 19% pitched on the same day in different games. And 13% pitched more than 8 months out of the year. And why is that more than 8 months out of the year so important, such a significant number? Because if you look at the bottom there, if you pitch greater than 8 months out of the year, 500% increase in injury risk. Pitch more than 100 innings in 1 year, 350% increase in injury risk. How do you get to pitching more than 100 innings a year or pitching more than 8 months out of the year? You pitch for multiple teams. So number 4, limited mobility. You're stiff, you're tight, or poor motor control, meaning your ability to control a movement, can also lead to increased injury risk. And like we mentioned before, the whole body works in unison to pitch from the head to the toes. Okay, so any limited mobility in one area causes another area to compensate or to have more stress put through it, and then that can lead to injury in that area. Right? If you have limited mobility, it can also be a reason for somebody who has poor pitching mechanics. Right? If they just can't get into a certain position or can't get somewhere, they're going to compensate and potentially have abnormal mechanics. So when you're working with a medical professional, it's essential that they look at their entire body, okay, again, from head to toe. And all too often this doesn't happen. Physicians or other clinicians, they focus on just the area that's hurting, okay, and that it's like bailing water out of a boat instead of trying to plug the hole, right? If you just look at one isolated area, you're not going to get the whole picture. And for some pitchers, or lots of them, they actually have good mobility or even excessive mobility because they're loose from pitching, okay? Their problem could be that they're unable to control that range, unable to use their muscles to control the joints and where they should be, and that's that poor motor control point. Okay? And that can lead to injury in those areas. So some of the most common areas we see that are limited for pitchers are shoulder internal rotation, also shoulder external rotation. So really just shoulder rotation in general. We have to look at the total arc of that. Shoulder flexion, your ability to raise your arm straight over your head. Elbow extension, getting your elbow straight. Your thoracic spine is a common area again. Hip rotation is a big one. And ankle dorsiflexion, which is the ability to pull your foot towards your body. If you can't move that well, then it just affects everything up the chain. Number 5, not having a post-pitching arm care routine, or I should say a quality post-pitching arm care routine. Okay, so what do most people do after they pitch? They throw some ice on their shoulder and elbow, for 10, 20 minutes, and that's it. That's what they do. Okay, and ice is not an effective recovery tool. It can be effective when you're using it for pain relief, but you shouldn't have pain after pitching. If you're in pain after pitching, that's another problem. Okay, about half of MLB teams don't ice their pitches after games, and that number continues to rise. Again, we use ice for pain relief, not recovery or reduced swelling. It will not be effective for that. I know most of you say, oh, but the RICE acronym, the rest, ice, compression, elevation. That was developed in the late 70s for how to treat injuries, and the person who created that term, that acronym, actually recanted it back in 2014. He said that the rest and ice, he got it wrong. That does not help with recovery. So some of the things that do help are active muscle contractions that help bring in the blood flow, help promote blood flow, and they, essentially they help remove the, quote unquote bad stuff and bring in the quote unquote good stuff. Okay, and you can do this through just some active movement. Some light band work is very common in baseball. Something like a Mark Pro unit, which is a little stimulation unit that contracts the muscles very slowly for you and helps flush things out and bring in the good stuff. So another thing that an arm care program is vital for is to help you recover mobility that is lost after pitching. So there's studies that have shown that immediately after pitching, that pitchers lose motion in their shoulder and in their elbow. Now, if you do nothing about that, the next time you pitch, you're pitching with that lost motion, and then it gets worse again, and then it gets worse again, and it snowballs. So you have to recover that lost range of motion, and you can do that with a arm care routine afterwards. So here's just an example of a 6-minute arm care video that I made. You can check it out on the YouTube channel. But again, it's just a 6-minute thing. Very simple. It's basic. It just covers the primary principles, and something as simple as this is so much better than just throwing ice on or something like that. So number 6, being weak. Right? Being weak sucks. Nobody wants to be weak. I haven't found anything that getting stronger doesn't help. Okay, and throwing a baseball, considering it's one of the most stressful motions in all sports, wouldn't it make sense to be as strong as possible to minimize that stress, to control that stress? Okay. The stress of the UCL ligament, the Tommy John ligament that gets injured for people and requires surgery, the actual strength of that ligament is less than the stress that's put through your elbow when you're pitching. So what does that mean? That if you relied just on that ligament to dissipate that stress through your elbow, it would blow out every time. So that means that you need muscles to help out. You need muscles in the shoulder, the legs, everything to help dissipate those forces. Muscles in the elbow too. Okay, I always tell people that, not just with baseball injuries, but any injury in general, or just living life in general, that strength can give you more of a quote unquote buffer zone, right? It allows you to tolerate more things, or to have more of a buffer zone of when an injury can happen. Somehow along the ways, weightlifting and baseball got I guess a bad rap, or was never viewed as a benefit. Luckily, that's changed over the past decade or so. Kids are getting much more in the weight room, getting stronger. Okay, and a weightlifting program reduces injury risk, it improves confidence, it increases throwing velocity. Okay, I still don't understand how some people want their kid to throw harder, and all they tell them to do is just throw more and more and more and more. And the only thing that's going to do is get them injured, and they're not going to throw harder. You want to throw harder, you put more force into the ground, you get stronger, and more force comes out when you're throwing. And then we get some people who still say they're too young, weightlifting can cause an injury, and I always tell them that weightlifting isn't dangerous, but being weak and throwing a baseball is. Right? And say, oh, when can you start weightlifting? I always say when, you have to find a good professional to help you out, but when your son can take direction, is willing to listen, then you can start to learn the biomechanics of certain movements and motions, certain exercises, and then as he gets older and learns them more, you start to load them up more. And just a little side note, I can't tell you how many kids I've seen our parents say that they're an amazing pitcher, they throw hard, and then I ask them to do something simple like a push-up, and they can't even do a push-up correctly, with good form. So they can't even do a push-up and control their body doing that, but we want to ask them to do one of the most stressful, crazy things in sports, throw a baseball. So pitching through pain. I kind of alluded to this before when I said that some coaches, a percentage of coaches knowingly have allowed people to pitch when they said that they had pain. Pain is essentially your body's alarm system going off and saying, something bad is going on here. Okay, I don't know exactly what it is or why it hurts, but stop. Okay, that's your house alarm going off. Something's going on. Figure it out. Okay, and don't just stop and ignore it, thinking it'll go away. Get it checked out. The other thing pain will do is pain will cause unwanted compensations or altered mechanics, and then this is going to increase your chance for injury in another area of your body. So you're shielding one area because it hurts, but then you're putting more stress on a different area. Now, pitching through fatigue, if you thought pitching through pain was bad, pitching through fatigue, the numbers on that are even worse. So one study found that regularly pitching with arm fatigue increases your risk of injury by 36 times. That is an insane amount of increased risk. Okay. Factors that can increase the chance of a kid being fatigued: not monitoring pitch counts, pitching for multiple teams, playing baseball all year long, the usual culprits. The more you throw, the more likely are you going to have more stress, more likely you are to get fatigued. Okay, being weak. If you're stronger, you're going to have more of a buffer zone again, more of an endurance factor. Other factors, general life factors, I call them. Dehydration. Most kids are in some form of dehydration. Poor nutrition, poor sleep patterns. All of these things can lead to a general poor performance in your body and lead to more fatigue. Okay, some of the signs that a pitcher is fatigued, most of you know these already. Just general demeanor, how the kid's walking around, do they look tired, are they skipping warm-up throws, are they taking more time between pitches, mechanics-wise, are they landing more upright, okay, standing tall, do they have a shorter stride, has their arm slot changed. The obvious ones also, losing velocity and or control, they just start to get wild. So those are all signs that pitching through fatigue is happening and you want to stop that. Number 9, not properly warming up. Just the stretching in lines out in left field or right field, static stretching. I wouldn't do that. Some kids just jump out of the car and go because they got there 2 minutes before the game started. That's obviously not good. A lot of kids, especially on travel teams, you're traveling, could be 30 minutes up to an hour, even more, to get to a game. So you have a sedentary kid for an hour, and then they're just supposed to hop out of the car and just go from 0 to 100. Okay? Again, throwing a baseball is super stressful. You want to ramp it up accordingly. Okay, so make sure you arrive at a game with proper amount of time to allow the kids to prepare and to get warmed up. Okay? You want to have a dynamic warm-up, then a throwing warm-up, then a pitching warm-up. Again, you just want to ramp it up. You want to progressively get more and more so that they're appropriately prepared to pitch. Now, the benefits of a dynamic warm-up: it improves performance, and this just not just with baseball, but anything. If you're playing a different sport, if you're weightlifting, it improves performance, decreases injury risk. So it gets your heart rate going, it gets your body temperature up, it gets the blood flowing. Okay, it improves your range of motion, and it helps activate the central nervous system, which helps with coordination and movement and things like that. So here's just an example on my YouTube page of another dynamic warm-up. So number 10, the last one, poor pitching mechanics. Okay, poor mechanics cause increased stress, strain in different areas, and that's going to increase your risk for injury. Most commonly, you're going to see poor mechanics causing more strain in the shoulder and elbow because that's the end of the chain. Okay? The reasons for poor pitching mechanics, ignorance, they just don't know the proper ones or they weren't taught. Okay, they're limited mobility, they're tight in some areas, and that doesn't allow them to get into certain positions. Poor motor control, they just don't have good control of their body or coordination or strength. Being weak, like I just mentioned, if you're weak, you can only maintain a certain position for so long. Or fatigue. Somebody could have good mechanics at the start of a game, and as they get tired, they just goes to crap. So some of the other topics I didn't touch on that some of you probably thought I would. One of them being curveballs or pitch type. Curveballs are the most commonly researched one, and the research is mixed on the effect of curveballs. There's some research that shows it increases injury risk, some research that says it doesn't. When you look at the actual stress on the shoulder and elbow with a curveball and comparing that to a fastball, there's less stress on the shoulder and elbow with the curveball, which some people probably think that's counterintuitive. But remember, a curveball, your arm comes through at a slower speed. And the faster you throw, the more stresses go through the shoulder and elbow. So the fastball creates the most stress to the shoulder and elbow. Another reason why I think the research is mixed is because it's somewhat of a biased factor to look at, because the kids who are probably throwing curveballs are most likely the better pitchers, so they're already throwing harder. And if they're a better pitcher, they're probably throwing more often, and they're probably pitching for multiple teams. So the better players are the ones who tend to throw curveballs. They can pick them up faster, they can learn them faster. So are they more likely to get injured because they threw a curveball, because they throw harder, they throw more, they're better? So that's why it's a little bit of a muddied water type thing there. And one of the other things I always talk about with parents and kids is I call them pillars of optimal performance or recovery. Whenever somebody's coming to me for an injury, you have to make sure you're getting good quality sleep. You have to make sure that they're properly hydrated. You're not eating like crap, eating well, and that their stress level is reasonable. Right? If you get a kid who's completely stressed out at school, he's just not going to perform well. So in summary, play multiple sports, be the best athlete you can be, limit the exposure, don't pitch for multiple teams, pick which teams you want to pitch for. Absolutely use a pitch count. Okay, that is so easy for you to do. If the coaches won't do it, then you do it yourself. You perform a dynamic warm-up before throwing. Don't pitch through pain or fatigue. Have a quality post-pitching arm care routine. Get stronger. It's not going to hurt anything. Get your movement and mobility assessed by someone who specializes in baseball injuries or working with baseball players. Sound, consistent pitching mechanics. And live a healthy lifestyle, with regards to sleep, nutrition, stress, those things. Just a bunch of references, just so you know I didn't make this stuff up. So if you have any questions, feel free to shoot me an email. You can share this with your friends, with other coaches, with the league that you coach for or your son plays for. I'm more than willing to present this to your league or to other coaches, parents, whoever. It could be in person or via webinar. Usually there's more of a discussion that way, and you can answer questions. So don't hesitate to reach out. I hope this helps. I hope this saves a couple of kids from getting injured. Then it's all worthwhile. But I'm hoping that you share it with other people, and we can really make a combined effort and help reduce injuries in kids with regards to playing baseball. Thanks.